Hi, good morning. Today we are going to talk about the scientific evidence and statistical evidence supporting the integration of modern medicine with complementary and alternative medicine. So, the first point is widespread use of complementary and alternative medicine, which reflects the unmet needs in the modern healthcare. The statistical surveys across the high income countries consistently reveal that significant public utilization of complementary and alternative medicine suggests a response to perceived gap in the conventional care. In United States, approximately 42% of adults reported using some form of complementary and alternative medicine in past year, and a number that has steadily increased over past 2 decades. In United Kingdom, a survey commissioned by the Department of Health found that 25% of adults had used complementary and alternative medicine therapies, with the usage rates higher among those with chronic or complex condition. This has not been out, but this is through the sources that we have. These trends highlight not only the growing acceptance of the alternative therapies, but also latent demand for more holistic, patient-centered care. Importantly, most of these users seek complementary and alternative medicine not as a replacement, but as to complement the mainstream medical care, which is usually modern medical care. This co-utilization behavior underscores the need for integrative models that formally harmonize the complementary medicine and the modern medicine with a single evidence-based framework rather than leaving patients to navigate dual systems on their own. The second point I would like to highlight is the better clinical outcomes with the integrated care models. Health outcome studies comparing the conventional and the integrative approaches consistently show that superior results are available with the integration. For example, a longitudinal study at Cleveland Clinic's Center for Functional Medicine evaluated over 7,000 patients receiving integrated care and found that they achieved twice the improvement in the physical and emotional health scores compared to those receiving standard care alone. Similar results were seen in Kaiser Permanente's integrative medicine pilot program, where chronic pain patients receiving acupuncture, mindfulness-based stress reduction, and nutritional counseling reported a 43% reduction in pain severity and 50% increase in functional capacity within 6 months. In oncology, integrative programs combining chemotherapy with yoga, acupuncture, and mind-body therapies significantly reduced fatigue, anxiety, and nausea and improved the treatment adherence. These findings validated the patient-reported outcome measures and show that integration not only addresses the physical symptoms but improves the psychosocial resilience, something traditional moderns often overlook. The third point I would like to highlight is reduction in the pharmaceutical dependency and the side effects. A major benefit of the integration lies in the reduced dependence on the pharmacotherapy and its associated side effects. In NHS integrated clinics where complementary and alternative medicine was offered for chronic pain management, including the acupuncture, osteopathy, and yoga, opioid use declined by 25 to 40% within the first year of intervention. Similar reductions have been reported in the United States-based veteran hospitals where integrated chiropractic and acupuncture into routine musculoskeletal care has shown significant improvement. These reductions not only lower the risk of the adverse drug reactions, which is a leading cause of hospitalization in itself, but also cut costs associated with polypharmacy. In 2018, a Cochrane review found acupuncture combined with the usual care reduced the need for analgesics in patients with chronic back pain and osteoarthritis. By offering the effective non-pharmacological tools for the symptom control, integrated medicine provides a crucial strategy in mitigating the global opioid crisis while enhancing the overall safety as well as the quality of care. The fourth point I would like to emphasize is economic gains from the integrative approaches. The financial implications of the integrated medicine are equally compelling. A comprehensive economic analysis conducted by Herman et al. Across 67 studies found that 61% of integrative therapies, including the acupuncture, yoga, and herbal medicine, were either cost-saving or cost-effective, particularly in managing chronic pain, cardiovascular disease, and mental health disorders. In UK, cost utility studies shown that complementary and alternative therapies delivered through integrative medical models, and this resulted in annual saving of over 400% and significant almost 360 to 400 pound per patient benefit in musculoskeletal care cases alone. These savings stemmed from the reduced hospitalization, fewer diagnostic tests, decreased pharmaceutical use, and improved productivity due to better symptom management. Moreover, integrated models emphasize the preventive care and self-management, both of which are known to lower the long-term healthcare expenditure. And given the mounting financial pressures on the national health systems, the scalability of the integrative medicine represent a practical solution for cost containment challenge and better patient care. The other point I would like to highlight is high patient satisfaction and health system efficiency. Integrative models have also been shown to enhance the patient satisfaction, which correlate with the better patient adherence or compliance, fewer complaints, and improved healthcare system efficiency. In a multi-center European study across 11 hospitals offering integrative oncology and pain services management, 78% of the patients reported improved emotional well-being, 68% reported better sleep, and 61% reduced anxiety. All of these are contributing to the lower patient follow-up visits and fewer emergency attendances. In Germany, where complementary and alternative medicines are reimbursed under statutory insurance for certain conditions, a 5-year analysis showed a 10% reduction in the healthcare utilization and the hospital bed days in the integrated settings. These real-world performance metrics confirmed that integration not only improves the clinical outcome but also optimizes the healthcare delivery by preventing the fragmentation, improving the continuity of care, and promoting a therapeutic alliance between the patients and multidisciplinary teams. A convergence of positive clinical outcomes, economic benefits, and patient satisfaction strongly validate the systematic implementation of integrative care in modern medical systems is much beneficial. Thank you.